All right, we're live on Facebook right now. Hi, everyone on Facebook that's tuning in right now. And I'm just checking in that we're also live on Instagram right now. Hi, guys. So I'm just checking everything's all good on our end. That's great. All right. Hey, guys. Welcome to the CPD Junkie podcast, #lockdown special, where every night at 8 p.m. we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who have already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and tonight we are joined by Dr. Roberta Vodola. All right. So, all right. So Dr. Roberta Vodola earned her master's degree in dentistry and prosthodontics honors in 2013 before relocating to Sydney. Following further studies, she successfully passed the AIDA exams and is fully qualified as an Australian dental practitioner. The way Roberta communicates with patients, people, is what drives her work to excel. She's very empathetic and caring dentist who makes everyone feel at ease, including kids and anxious patients. She's passionate about all aspects of general dentistry and strives to deliver high standards of care with her attention to details. She's a volunteer dentist at the Filling the Gap and a dentist for the Italians in Sydney community. When she is not in clinic, Roberta spends her time doing CrossFit, yoga, reading, acting school, and traveling. Pre-COVID, of course. Dr. Roberta Vodola, welcome to the show. Hi, Dr. Roberta Vodola, welcome to the show.
Hey, thank you so much for having me here.
So for many of our viewers who have graduated from Australia, can you explain what it means to have a master's in dentistry and prosthodontics honors?
Yeah, sure. It's pretty much actually the same kind of degree that you guys have here. The only thing is that in Italy, like, it's now 6 years and we don't have the chance to choose between undergrad and postgrad. So when I studied, it was 5 years straight after high school. But nowadays it's actually 6 years, and doesn't matter whether you have a degree or not, you will still go through the same journey, and it's from day zero to the end of the course. So it's a master degree. It's the equivalent of a master degree. Yeah.
Right. So you do an undergraduate. Is that how it works, of dentistry?
Correct. Yeah. Even if you have a degree, there is no chance for you to have a shortened path. You might have some exams that will be like, they might accept some of the exams, for example, if you come from a similar degree, like medical science or pharmacology or biology, but you still have to go through the same, long course. Yeah.
And so that final year, that's an honors in whichever specialty you kind of want to. Is that how it works?
No, it's actually, like, imagine I did 5 years. So in the first 2, it's similar to medical school. So we are actually together. And then from year 3 to year 5, you go to do placement and you have more courses just related to dentistry and still have some other medical kind of subjects or majors. Yeah.
Right. Okay.
Yeah.
So, Dr. Roberta,
it's different. It's confusing.
It is. That's why I brought it up for a lot of our Australian viewers.
I hope.
So, Dr. Roberta, tell us a little about your CP journey so far.
Okay. Yeah. Cool. Well, I'm trying to honestly do as much as I can. Last year during lockdown, I joined a lot of online courses. This year, I've done quite a few so far until, of course, the lockdown hit. And what I did was actually the medical emergency. So most of my CPDs are all related to the AIDA. Just if you're, private kind of, I would say. So I've done some sedation, some medical emergency as well, just to refresh. Also done surgical extraction. And I was planning to just refresh also endodontics, which was supposed to be this month. And then later on, but has been cancelled. Same, I'm planning to do Chris Ho next year, and also I might do some other couple. Yeah, in photography course, that's the one that I really want to do, the one that you guys are sharing.
Yes.
Yeah, Shabby, that really, yeah, it's really interesting. So yeah, that's the next. But yeah, I try to book all my courses at the end of the year, at the beginning of the year, for the, until the end of the year. But with COVID, yeah, things have been like a bit, yeah, weird.
It is, hasn't it?
Yeah.
So, I mean, you've mentioned a few different things. Is there a particular reason you picked those particular ones, or was there a bit of structure to it when you were planning and selecting the courses that you wanted to attend?
Yeah. So consider that, I graduated in 2013, and then consider that I also spent a few years in Australia to get my degree, and a lot of things, going on anyway over the years. But I still consider myself kind of a new grad in Australia. So my goal is first to be really good at, general dentistry. So have a very comprehensive knowledge. And that's why I'm refreshing the basics, to be honest, crown, veneers, endo, because you never know, everything, right? And it's pretty much the same, but you still want to, just, yeah, as I said, make sure that you do the right things before you go and do some more complex cases. So my goal was to do a little bit of Invisalign. Again, just normal, basic, stuff that every dentist should do before getting into more complicated treatments. So yes, it seems like nothing is related to each other and they are all different things, but no, it's just the basics, bread and butter.
Yeah, fair enough. Well, I mean, it's kind of just building on, our foundations, isn't it?
Yeah, it's also true that when you study, you think you might like some stuff, and then when you actually work in private practice, you might change completely your mind. So, for example, when I was at uni, I didn't like at all prosto, and then I had the pleasure and honor to work with Dr. Johan Choi while I was getting my degree, accredited, and just by looking at what he was doing and all the full mouth rehab, I just enjoyed it. I thought that's something that I would like to do in the future. Same thing for surgery. I thought that's not something that I'm interested in when I was at uni. And actually now that I'm doing surgical things a little bit more, I actually enjoy them. So I want to know more about that. So again, I don't like to be stuck. I just want to explore everything, a lot of stuff before maybe, getting into some specialization or things like that. Yeah.
Okay, cool. So you mentioned the ADC. So in your process to obtaining your ADC accreditation, can you share some of the challenges you might have faced?
The whole journey is a challenge. From day one, but thank God there was no COVID at the time. No, it's a very difficult journey because it's very competitive. Obviously, everybody wants to come to Australia and practice as a dentist, so they make it really hard for us. I spent nearly about a year just trying to get my documents approved, and it's a degree which is valid across Europe. So I'm actually able to work across Europe. And then when I came to Australia, it felt like, do you even have a degree? Like the thing that I had to prove and all the documentation and back and forth really took me about 11 months. Wow. Then you have the chance to sit for a written exam, which is over 2 days, and you need to re-go through everything you've done during dentistry. And you can sit once every 6 months. So that, takes some time also. And then I spent about 8 months just to prepare for the practical exam. And that was the craziest things I ever done. Literally, I had a dental surgery in my house. I had a mannequin, a compressor, and I would just practice 8 hours a day, even every day. Then I went to India to do some extra training on a mannequin, obviously. And again, I spent 2 months practicing 9 hours a day, every single day. And then when I came back, I just decided, okay, I'm going to sit for my exam and, fingers crossed. And thank God I was able to pass it, because financially, it's hard. It takes a long time. And if you miss a chance or you fail, you need to wait, and you might wait again for other, who knows, 6 months, a year, you never know. So in total, my journey took 3 years.
Wow.
A lot of study, a lot of yeah, sacrifice, but it was worth it in the end. Yeah, it was worth it. Yeah, I'm happy that's over. You always learn, even if it's the same thing. You know, people say, oh, are teeth different between Italy and Australia? No, materials the same, procedures are the same, but you always learn something. And there are some guidelines specifically for Australia, so it's good to, you know, yeah, learn those as well.
So I guess, where did you go to kind of, I mean, it's a lonely journey, I would imagine, so, where do you go to find more information? Where do you go to kind of build a community? Like, how did you go about doing all of that?
Yeah, when I started, honestly, I had no clue, because I actually was already in Australia living here. And then I thought, I might get my degree also approved. So I started, I was a bit naive, to be honest, and maybe that was a very good thing, because when you know the process, it's so scary. So I found a lot of information actually online. There are a lot of Facebook groups, a lot of people. So I was able to connect, and honestly, that helped a lot. Like, you study together, you just, discuss cases, and you share information, and the more you do it, the more you learn, the more you have chances to pass. So it was all like, I met amazing friendships during those 3 years, and there are some of these girls and these people that I never met, but we are friends, and we still are in contact, and we are in Australia, in different part of Australia, just because of the ADC. So definitely online, a lot of stuff online, a lot of contacts, networking.
And then you mentioned you went over to India for a little bit as well, to do the mannequin. Tell us about how that kind of came about.
Yeah, because there are a lot of courses. You definitely need the guidance, some sort of mentorship, or anyway, somebody, because it's a very sophisticated and very complex exam, the written, but especially the clinical, the practical one. So I really wanted to practice a lot. And for example, in Italy, we don't do a lot of complex amalgams, or there are some stuff that you still need to do in the exam. They are not really taught at uni. So I just felt, I might just go to India. There are a lot of schools, and I knew some of the people there, had an experience there. Yes, I will go somewhere. I've never been to India. I'm going to travel by myself. It's crazy, right? But I felt like, I think I'm going to give it a go. I'm very positive, and worst case scenario is going to be just a trip, right? But actually, I had a great experience there. I've learned so much. They literally taught me a lot of stuff that, were very, very important for the exam, because they know really well. A lot of schools, they now know what the exam is. So they teach you what you need to know, exactly how you need to prepare teeth. And so it was crazy. And literally, I spent 2 months studying a lot, practicing a lot, nonstop, Sunday included. And I traveled really little. I mean, I just visited Delhi for 3 days, and the rest of the 2 months was full on. But again, a great experience. And again, thanks to the ADC. Oh yeah.
I can't imagine, when you've done like 6 years of uni, and then you've stopped studying for a good solid, and then you come back, and then you have to get back into it in a very short space of time. That's very full on.
Yeah, that's true. Yeah, but when you are there, when you are in, you don't even think straight. You just go. And I was like, what should I do? Like, just forget my degree, or no, I'll just do one step at a time. And then you focus on one step, and then one step goes well, and then you go on the other one, and then tick, tick, tick. At the end, you look back, and you've done it. So that's how it works.
So of all the CPDs that you've taken so far, what would you say has had the biggest clinical impact on you today?
Look, it was very helpful, the sedation one, because I've had a lot of patients that needed sedation. I'm talking about happy gas. So straight after I did it, I took the course. I was able to perform, on some of the kids that I had. With also the surgical course that I took, that was about June. With a Max Pact and Dr. also Sue. Honestly, it's helping me to kind of understand which kind of, for example, wisdom teeth I can remove and when it's actually better or safer to refer. So definitely that was an hands-on as well. And we had, a pig head and we had to do stitches and we had to remove pig's teeth, of course. So I learned quite a few things. I mean, I knew the basics again, but it's always good to confirm what you're doing and make sure that you're doing the right things. What else? Emergency is always important, I think. Like you always need to refresh, CPR and how to react in an emergency situation, because it doesn't matter. You always know it, but if something happens, you're never going to be really ready. So yeah, I try to be updated with that. And I was very excited about the new courses coming, but as I said, I can't talk about that.
Yeah, no, fair enough. So would you say that you kind of approach for more like hands-on kind of CPD to kind of, that's where you wanted to double more of where your CPD attention was?
Yes, first because of course you want to also do a bit clinical things and all, but the main thing is also networking. I think it's really amazing to go there and then meet with other colleagues and introduce yourself, also. Yeah, I think that's the main thing, and that is also why I don't really like online kind of courses. It's just different. Yeah, the approach is different, and you want, like, if one day I have a trouble and I want to refer to a max spa, I really want him to know who I am. I want to introduce myself first. I want to build a relationship as well. It's all about that at the end. Yeah,
you want to be comfortable who you're going to refer to, and you want them to know who you are so they can kind of have an open communication, right? Yeah, I 100% agree with that.
And it's nice too, because in the dental field is so small in Australia, right? So it's just nice to connect, and yeah, we are following each other on social media, but you actually want to know and have a personal relationship as well, I think.
100%. Following on from that, who has been your biggest mentors or idols in your career path, and why? I mean, I think you've mentioned a few names already, but
Yes. Actually, guys, I really want to also tell you that I've joined the mentoring program with the Australian Dental Association, which is a great program for new grads. So I'm not sure whether you're spreading information about that, but yes, that's something that I'm doing as well. So I guess mentoring is essential. You can find mentors everywhere, obviously. You don't have to have a program, or I always ask opinions and I always share my doubts with other clinicians. But definitely after I traveled in Australia for 1 year, because I was supposed to be here for 1 year as a traveler, I ended up working for Dr. Johan Choi and Dr. David Zhang. They were opening up their practice at the time. So definitely Dr. Choi and Dr. David also, I would consider them mentors. With Dr. Johan, I literally I just saw how he grew, how he started, and what he achieved. So how technically he's just amazing. So definitely is one of the the main mentors that I had in my life. I would say now that I'm joining also I'm a mentee of the mentorship program. I'm actually paired with Dr. Kate Amos, and she's lovely too. She's amazing, and I'm quite sure I'm going to have a great journey with her. So I'm looking forward to having 10 months of growth and learning. Look, I don't know, I think I had quite a few, to be honest. Also, for example, I have some colleagues that I met during the ADC. They have, some of them are very knowledgeable and skilled in their countries as well. For example, some of them may be really good at implants. So when I have, for example, a case, I might just, contact them and say, hi, what do you think about this? Or maybe some of them are perio in their countries. I know that they are not specialists here, but I know that they can kind of mentor me or can just help me. And I just like to have different opinions about, even a single case. So a lot of my colleagues, I would still consider mentors. Whoever can teach you something I guess it's a mentor. And Dr. Omar Ikram, the endodontist as well, is so nice. And every time I have a question and I just ask him, look, do you mind if, I just share this out straight away, he has an answer and he's very keen on helping. So there are really great people around. So Yeah, plenty.
I think, just to make a few comments on that, I'm also in the AIDA New South Wales mentoring program. Yeah. Obviously, we didn't have the, because of COVID, we didn't have the meetup with everyone. So, that would have been an opportunity that I would have met you at. So I've been in it before, and this is another year that I'm in it. And I 100% agree. It's a great program for recent graduates to be in, to have someone who's a lot more senior to kind of provide a lot more support and, be that extra ear when you need someone to kind of give you some feedback, on a more regular basis. And someone that's outside the clinic to kind of give you that. I 100% agree. That's a great service that the AIDA is providing.
Yeah, absolutely. Totally agree. So yeah, if somebody has a chance next year, please just jump on it.
Yeah. A few other things that you mentioned, I think Omar Ikram, yeah, definitely I agree. I've had my fair share of when I've been pestering him with some endo cases, and he's definitely been happy to reply very quickly. So yes, definitely happy to give a shout out to Omar Ikram from Crow's Nest. Johan's just raving about you online at the moment as well through the Instagram live.
Yeah.
So you've mentioned you are the dentist in the Italians in Sydney community, appearing on SBS Radio Italy even, tell us a little bit more about this kind of community that you're kind of involved in.
Yeah, so look, when I first came to Australia, to be honest, I didn't hang out a lot with my community because the goal was to learn English and to travel and meet, people from all over the world, not just Italians. But I've noticed that since I started working as a dentist, a lot of people contacted me to sometimes, just, I guess when you're overseas, I'm not sure whether you're familiar with it, but when you're in a different country and you have a problem, medical problem or dental problem, it's really nice to have somebody that can speak your language. And sometimes people do understand, but they have doubts and they think they can't understand, or they don't know how to express their concerns or the questions. So I've started, just publishing information, trying to help people to understand how Medicare works, for example, how private insurance is, or just the dental field, because I have been here now for 7 years, and I've worked even as a dental assistant, as a receptionist, as a practice manager. So I know, I kind of got to know a lot of stuff even before being a dentist here. So if I can, help people out or understand a little bit more, even if they're not my patient, they might be in a different part of Australia, or sometimes they travel and they say, oh, look, who can I see when I go to Perth, for example? And I say, oh, look, I might find somebody that I might not know personally, but can look after you. And then I started research. So I'm kind of, I don't know, I feel like I have a role in my community as well, like to give back a little bit more, and to, share my experience, but also my knowledge, try to be, just try to help. Yeah, just try to help and connect them sometimes with specialists. Yeah, I think, and I enjoy this. I really enjoy this, to be honest.
That's so awesome. Yeah, 100%. Like, a lot of the people who are of ethnic backgrounds sometimes, want someone they can understand, affiliate with what they're talking about, and communicate, like you mentioned, is probably one of the hardest things, especially when it comes to dentistry, dental terms.
Yeah, and I work in different practices. So I work in Parramatta. And there are different, of course, demographics. So I sometimes face the same issue. Like I have a patient which speaks another language, and how can you get a consent, from somebody who doesn't really understand exactly what you are doing or what you want to do? So I think it's really important. So I try to share information, or I just let them know how things work here. Cost-wise, but not just that, anything. It becomes a bit too much sometimes. Imagine, people messaging you night and day, weekends. It's a lot, but at the same time, it's okay.
Well, it sounds like you've built a good reputation for it. So what would you say your ideal clinical day kind of looks like? What kind of procedures are you getting up to?
Look, I like variety in life in general. So I like when I can just perform different things. Like today, it's actually one of the busiest days during COVID. I'm not working much, but today I had, headaches. So I ended up doing a root canal, extraction and crown prep and, just a consult that will be, a treatment later on when, later on for sure. So when I can do different things and different treatment consultation as well. During COVID, actually, I've noticed that because we are doing emergency a lot, I love, diagnose and treatment planning. I love trying to, work out what can this be or what, but there is this in a crack and a perio. So it's just fascinating compared to a lot of days in which you might have 3 or 4 checkup and clean straight after, one after the other. Just, the same thing, I would say. But I do enjoy anyway talking to different people, because everybody comes in with a different story, with different problems, with different lifestyle background, and so even if I have the same kind of, oh my god, checkup and cleans 4 in a row, I still know that I'm going to meet different people. So yeah, I still enjoy it. But yeah, variety, I would say.
Yeah. So you say your clinical day, you like to do a little bit of everything.
Yeah, a little bit of everything. You get exhausted by the end of the day, like now, for example.
Yes, your brain is just fried by the end of a long day.
Exactly.
So share with us what you hope, your clinical day or non-clinical day, ideal, day would look like in 5 years' time. And, what kind of CPD do you want to do to kind of get to that point?
Sorry, the audio was not really great, so I couldn't get the question.
Sure. I was just saying, share with us what, you hope your ideal clinical or non-clinical day would look like in 5 years' time, and what CPD would you want to do to kind of get to that point?
Oh, wow. Look, at this stage, I think I would like to do a bit more. In 5 years' time, I'm thinking I would like to be more into full mouth rehab and cosmetic dentistry a bit more. But it's kind of a cliche nowadays. So, but yeah, this is my interest at the moment. How to get there? At this stage, as I said, I don't want to focus on one specific field of dentistry. Even if I like these sort of treatments, I don't want to just perform those or start just with that, because I still feel I need to understand everything, occlusion, like different disease before I focus, and because I might change my mind. I'm always open to change my mind in the future, who knows. How to get there? Learning, keep practicing. Sometimes I think, I should be studying more, I should be doing more CPDs, more than what I'm doing. It's crazy. But then I think you also need to practice and you need to face your challenges. And then when you understand, okay, I have a weakness here, then you go and do some CPDs, for example. So also CPDs are very expensive, right? So you can't just do CPDs, you still need to balance it off. But definitely, learning knowledge, that's the main thing, and practicing as much as possible, obviously. So together. So I will keep planning my courses. I will keep, working. Sometimes I take some more time, some extra time. I don't want to be rushed. I want to, just do my best for every patient. It doesn't matter if, my hour is very, it's not very productive. My practices don't mind so far. So yeah, take my time, learn, do my best. That's all I can do.
I like that mindset, the kind of thing you're talking about. You're going to do it at your own pace. You're going to, don't feel like you have to rush and do it all at the same one time. And, you've mentioned you want to do, like apply what you're learning, not just learning it theoretically, but also applying it practically.
Yeah, absolutely. Like, for example, I've done this Invisalign Go course. I haven't had time to, apply much. I took it 3 months ago, I think, I can't remember. Then, of course, now it's COVID. I'm not doing this kind of consultation, but also at the beginning, I want to find some cases that I think are appropriate for me. I don't want to lose my sleep at night time because it's already stressful, and we face a lot of challenges every day. Sometimes I work on my own. So yeah, I want to be safe. I want the patients to be safe, but at the same time, let's be honest. I'm gonna have probably another 30 years for my career. I don't have to achieve everything tomorrow, and yeah, I want to be skilled, but at the same time, I will be very, very skilled. But at the time, I will probably be very, very, very old. So it's okay, you know.
Forever 21, forever 21.
Yeah, exactly. So, you know, honestly, yeah, you look at other people and that's amazing. You can be, you know, I like to be inspired, but at the same time, I have my own journey. So I can't compare with other people, and none of us should actually. Yeah.
Yeah, you know, I think there's some good pointers there. I mean, you've mentioned it already. It was kind of leading up to my next question. You know, what kind of CPD do you feel like you didn't quite benefit from much at the time and would do differently? I mean, you've mentioned Invisalign Go. Is there another particular thing that, you know, you might not have benefited significantly at the time and you would do it differently?
Oh, actually, that's the only one, to be honest, because also, you know, with Invisalign, as you know, you need the software. So some practices might have it, some other practices might not have it. So you might not be able to, you know, yeah, it's not the right fit. So probably I should have waited. I'm not sure. You know, I'm happy that I took it anyway. And I'm sure I might planning in the future, maybe not, this is not the right time, but it's not, you know, it's not a waste anyway. It's a course that I took, and I just, yeah, I just need to plan a little bit later with a bit of delay probably, but still, you know, knowledge there. As I said, networking, I met other people there. So they're there to help me to set up, for example, connections between, you know, the scanner. So yeah, still worth it. I mean,
yeah, I don't you'll always learn something out of CPD.
Absolutely. Yeah.
So I want to take a little moment to talk about your volunteering for Filling the Gap. You know, can you share with us your experience about that?
Yeah, sure. I always want to do some volunteer kind of experience when I was a student even, but at the time I didn't feel right because, again, you still need to invest some money to go on a trip or to go, you know, overseas. And I felt like my parents were already paying a lot of money to, you know, allow me to study. So I just say, okay, you know, one day I'll do that. So then a couple of years ago, I was a member of the AIDA because of my ADC journey. And I found out that they have a program, and I just asked whether I could join it. And they said, yes, you can, but of course you can just be a dental assistant. I said, fair enough. So I did a couple of times, and it was really nice, to be honest. So after I got my license in Australia, I kept my connection with them. And even after I was able to work as a dentist, as a volunteer dentist. And again, there are a lot of people that are in need. ADA has a lot of also, you know, they have availability. I mean, they have funds, and they can help people, and they actually are searching always for dentists that want to join the program. So some days they struggle to find DAs, dental assistant, or, you know, as you know, or dentists as well. So yeah, when sometimes they are in need and they might shoot me an email last minute, if I can, I might take a day off and just help them out. And again, it's rewarding. Yeah, it's always rewarding when, yeah, you meet people that really can't afford dentistry and they need your help, and you can do something for them, even if you don't earn any money. It's okay. Yeah.
That's so awesome. I feel like you're a strong advocate for ADA, eh?
No, it seems like.
You know, you should join the ADA and become part of the recent grad committee too, even. Something I learned about you is that you embrace personal growth and development. You know, you don't like to define success as only a job salary, your title, but, you know, about your physical and mental health, free time. A book that you refer to is The Untamed by Glenn O'Donnell.
Yeah.
There's a chapter on sandcastles, I believe. Can you explore how that chapter kind of particularly resonates with you?
Okay. Well, it was a bit of a feminist kind of chapter, but no. It's
2021. It's all good.
From memories, because, you know, I read a lot of books. That was a while ago, a few months ago. You know, all of us, I mean, we find identities in what we do. And I struggle always with that because, for example, yeah, we are dentists, but my identity is not being a dentist. So my identity, for example, is not being, for example, a mother. I struggle to, you know, put myself in a frame. And that chapter just says that when you always talk about yourself related to another person, whether it's your son, your daughter, your husband, your career, sooner or later, these things are you're gonna lose them, because at some point you're not gonna have your job because you might retire. Your kids might grow up and they leave you, or your partner, whatever, you never know. So your world might collapse at the time. And that just made me think about, do I really want that? Do I feel like I am a dentist? So one day, if I can't work as a dentist, I feel I'm no one, or I don't have an identity. And I found that I love and enjoy a lot of things. Like, yes, I'm a dentist, but I have an interest in medical, just health in general, and fitness. I guess it's all connected. When I see my patients, for example, in the clinic, I can't ignore what they're eating, what they're doing, if they're obese, if they're smoking, if they're pregnant. It's always important to understand the person. It's not just their mouth or their teeth. So I guess I apply this kind of mindset. I related to the book, but apply that to my life and to their life as well. So that's why I just, I don't know, I think I just explore a lot of things. And that chapter just remind me that you don't want to have an identity related on or linked to somebody else. You need to find yourself. You need to discover your strength, your weaknesses, focus on yourself, not in a selfish way, but just in a way that you are fully aware of your, who you are, and then you relate to others. I hope I expressed what I was about. I'm sorry,
I put you on the spot. Hey, you probably weren't expecting that question.
That was a tricky one.
Dr. Roberta, thank you.
More for women. It was more for women. Don't worry, it's all good.
It's all good. It's 2021. It's all good. Dr. Roberta Vodola, thank you for coming on the show. If you can let the people know how they can find you and what's kind of going on, or if you leave any lasting words for the young graduate that's coming out.
Oh, well, look, I really don't like to give advice. I really feel every person is different. Everybody has their own journey, but just do what you feel. I think just try to improve every single day. Don't worry about challenges. We all have them, to be honest. Every single day is a challenge, and whatever process you start, whether it's, another degree or a family or moving overseas, for example, and start living in another country, every time, there is a difficult, you're going to go through some obstacles. So just focus one day at a time. Try to go to work, be positive, understand sometimes you might not know everything, or you might not be, super skilled, but it's okay. I mean, you just need to learn those skills. You just need to learn more. That's all. That's all it means. So don't worry about failure. Just do your best every day. That's what I think. And CPD is learning in all different forms, whatever works. Follow people, ask. Yeah. Just be
Awesome. Thank you so much again. Thank you so much. I want to say to all the audience tonight, thank you for tuning in. We're going to be back again tomorrow, same time again, with Dr. Ricky Lim. If you guys tune in at 8 p.m. as well, that'd be so awesome. Dr. Roberta, thank you for coming on the show again. I hope you have a great night. Get some rest.
Thank you. You too. Bye. Thanks for having me.
Bye.
Bye.